Ever wondered what really happens during a wisdom tooth extraction? Let's break it down, step by step. First off, what are wisdom teeth? They're the third set of molars that usually show up in your late teens or early 20s. For some people, they come in without any issues. But for many, there's just not enough room in the mouth for them to grow properly. And that's when the problems start. They can push against other teeth, come in at odd angles, or even stay trapped beneath the gums. That's what we call impacted wisdom teeth. And when that happens, removal is often the best option. So, what actually happens during the procedure? It starts with X-rays. Your dentist takes a close look to see exactly how your wisdom teeth are positioned and whether they're impacted. Next comes anesthesia. Don't worry, you'll be completely numb and won't feel a thing. Just a bit of pressure here and there. Then, your dentist gently opens the gum tissue around the tooth and uses special instruments to loosen it. Sometimes the tooth needs to be sectioned into smaller pieces to make removal easier. It might sound intense, but it's a routine procedure that usually takes about 30 to 45 minutes. Once it's done, you'll get a few aftercare tips. Use ice packs to reduce swelling, rest up, and stick to soft foods like yogurt or soup for a few days. Most people start feeling much better within a week. So there you have it. A quick, simple look at what really happens during a wisdom tooth extraction. It's safe, common, and nothing to worry about. Millions of people have it done every year. Got questions about the process? Drop them in the comments, and don't forget to like and follow for more quick dental tips.